Hi, it's Alicia. I'm here doing my video recording for my comprehensive head-to-toe assessment. I'm using the lab at Hutchinson Community College in their allied health department. My subject, I guess you would call him, is my husband, and he will be with me through this whole assessment. For video's sake, I will come over to the computer a couple of times just to check that the video is still recording me. That way I don't get completely done and it quit going at some point. I am using a fairly small lab room, so my setup is against one wall and it cannot be seen on video just because of the size of the room and the way my computer sits. However, we'll get into position and get started. Alright. Hi, my name's Alicia. I'm going to be your nurse practitioner today. Can you tell me what you came in for?
A wellness checkup.
Okay, so we'll do a complete head-to-toe exam. We'll start with doing your vitals while we talk about a few things. I'm caught on board here. Do you know approximately what your current height and weight is?
5'10", 180 pounds.
Okay, so do blood pressure. I just tested this an hour ago.
There it goes.
Okay, we'll do under your arm since this is the labs thermometer. Okay. So temperature is 97.2, axillary oxygen level is 94, pulse is 66, and blood pressure is 132/90. Patient appears in a general well-being of health, is well nourished. He appears well taken care of, dressed appropriately for the season. His speech pattern is good. So we're going to check a few things. We'll start with your head and go down. Before we start that, I want to ask you, can you tell me what your full name is?
Daniel Scott Utley,
And where are you right now?
Hutchinson, Kansas.
And what day of the week is it?
Wednesday.
And the current president?
Trump.
Okay, perfect. And let's do, I'm going to turn this off before it starts beeping at us. Maybe. There we go. Okay, and then I'm going to ask you to remember 3 words: blue, car, and 8. So hang on to those for a little while, and I'll ask you again to repeat them in a little bit, test your memory a little bit.
Okay.
Okay? All right, perfect. So we're going to start with the head. Head appears symmetrical, no physical deformities seen. We'll palpate the scalp. Hair is thick, evenly distributed. It's brown. There's no balding noted. No mass is palpated. Okay. So we'll go ahead and do some of your lymph nodes. Cervical lymph nodes. Postauricular lymph nodes. Preauricular lymph nodes. Submandibular and submental. It's a little hard to feel due to facial hair. Lymph nodes are normal, most non-palpable. Facial bones are symmetrical. Okay, do you have any tenderness when I tap right there?
Nope.
Okay, frontal sinuses are good.
Nope.
Maxillary sinuses are good without pain or pressure. Okay, next thing I'm going to have you do is close your eyes shut all the way. Open them real wide. Eyebrows up, that's good. Okay, puff your cheeks out. Smile. Frown. It's a hard one. Hold on, I'm going to fix this. They can't see me. Sorry about that. There, that looks better. Okay, so I need a cotton ball. I'm going to test some sensation in your face. So far, cranial nerves 5 and 7 are intact. Go ahead and close your eyes for me and tell me if you feel touch.
Yes. Yes.
Okay, that is in addition to cranial nerve 5. So, that's all good. We're going to do eyes. So hair on the eyebrow and eyelashes is distributed evenly. Symmetrical eyes. Sclera is white, tiny bit bloodshot, but he's worked a 13-hour shift today, so we'll give that to him. Otherwise, looks good. Now look here. Conjunctiva, up and down, both. Conjunctiva look good. Any tenderness or any issues with your eyes that you know of?
No.
Okay. Here we go. We're gonna take a peek at them. And we are going to do a screening exam on your vision. And I think that is all I need for that. Okay, so let's go ahead and check your vision first. So we'll have you have that. I'm going to have you stand right here where this piece of tape is. I could not find a Snellen chart that was less than 10 feet, so we are using a Snellen chart with 10 feet. So I'm going to first have you do it with both eyes. Read the smallest line on that chart that you can read.
8.
Okay. No, not that. Sorry, the letters.
No, that's the line. You want me to read it?
No, yes. Please read the letters from left to right.
D-E F-P-O-T-E-C.
Okay, and let's go ahead and cover up your left eye and do that again.
Yikes.
What's the smallest line you can read?
7.
Okay, go ahead and read it for me.
F-E-L-O-P-Z-D.
Okay, so go ahead and uncover that eye, give your eyes a minute to adjust, and then cover the right eye, and we'll test it again.
Okay.
Good. Okay, smallest line, can you...
8.
Okay, go ahead.
D-E-F... No, sorry. T-F... No. D-E-T-P-O-T-E-C.
Okay, so your vision's looking at about 20, 25 to 20, 30, 20, 35, somewhere in there, depending on which of those lines you can read. So for patients with visual acuity issues, I would suggest that they see their optometrist if they haven't seen one recently, and go from there. So we just tested cranial nerve number 2, the vision screening. So the next thing we're going to do is take a peek inside of the eye. I'm going to take my otoscope apart. Excuse me for just a second. So we can check response to light and visual fields and all that good stuff. Okay. Oh, that piece, the light fell off. I mean, the magnifier fell off. Okay. So, first I'm going to just have you look straight ahead at the wall.
Okay.
Don't look at me. Okay, so testing the pupils. Pupils are equal and round, reactive to light. Go ahead and follow my finger with your eyes, not your head. Okay? Up and okay, to the middle, all the way in. Okay, accommodation is intact as well. Extraocular movements are intact. So we have now tested cranial nerves 3, 6, and 4. So 3, 4, and 6 have been tested. Cranial nerve 5, we don't test. It's the corneal reflex, and we would use a cotton ball and touch the cornea with it, but that is not very comfortable. And so we do not do that. So I'm going to now check the inside of his eye if I can get this to do what I want. Okay. The lights in the lab are automatic, so if there's people in here, there is not a way to turn them off, so I cannot dim the lights for the purpose of this exam, but normally I would. Okay. So, first I just need you to stare straight ahead, again at the wall. I'm going to start with my light out here. I'm going to move it in very close to your eye, okay? Okay, here we go. Okay, so light shines in both eyes, so light reflex is positive. And I'll talk. That way the light's not shining in your eye all the time. Okay. So both eyes, sorry, we went dim, so I want to make sure we're still recording. Okay, so both eyes have red reflex noted. The lens is visualized. The disc margins of both eyes are sharp. I am able to visualize vessels in both eyes, and disc margins are sharp, and I was able to visualize vessels in all eyes. I didn't see any cotton bodies, I didn't see any tortuous veins, nothing concerning that direction. Okay, so after eyes, we're going to do, excuse me, I'm going to grab a drink of water because it's like 100 degrees in here. Okay. After eyes, we're going to work on ears. His ears appear symmetrical. They're aligned evenly, horizontally. No redness noted, no masses noted. Do they hurt at all?
Nope.
Having any ear pain at all?
Nope.
That you can think of? Okay, so I'm going to check your hearing and look in your ears too. Get our otoscope put back together. It's kind of a pain. Need that back going in a minute. Okay, so let's take a look inside your ears here. Okay, so auditory canal appears patent. There is some cerumen buildup. It's not blocking the canal. But I had to get around it. Sorry about that. His tympanic membrane is pearly gray. The cone of light is at 5 o'clock. No redness, no concerning exudate. Everything looks good in that side. Let's take a peek at this side. This side is almost identical. Again, I'm able to visualize the cone of light. Got some cerumen buildup, but no redness, no concerning exudate in the ears. Okay, so now I'm going to test your hearing with this tuning fork and without. So what I'm going to have you do is plug one ear and then repeat the whispered word that you hear after me.
Hospital.
Okay, and go ahead and plug this one.
Blue.
There we go. Okay, so he was able to hear the whispered words and was able to repeat them appropriately. I'm now going to test bone conduction, air conduction, hearing with tuning fork. Okay, so what I'm going to do is strike this fork and put it behind your ear. You tell me when you can't hear it anymore. Then I'm going to move it out front and you tell me if you still hear it. Do that on both sides. And then after I do that, I'm going to strike it again and put it right here, and I'll need you to tell me if you hear it both sides equal.
Okay.
Can't hear it? Okay. I just don't want to strike it too hard if we'll be here all night. Can you still hear it there?
Yes.
Okay. So air conduction is greater than bone conduction in the right. We'll test. Air conduction is greater than bone conduction also on the left side. Excuse me, I had those backwards. Right and left are both though. And then we're going to do the
What am I supposed to tell you?
if you hear it equally on both sides.
Yes.
Okay. So hearing appears to be intact. We have now tested cranial nerve number 8 with that test. And I think that concludes our ear exam. So after ears, I need to hold on to this for just a little while because I need to look at nose and mouth. Don't need the rest of the stuff. Okay, so nose appears symmetrical. Do you have any stuffiness, congestion, etc. in your nose?
Not at the moment, no.
Okay, any pain?
No.
Okay, go ahead and close one nostril and breathe in for me. Okay, switch sides. Okay, so bilateral layers are mostly patent. We'll take a peek in there here in just a little bit. And then we'll test your sense of smell as well with a couple of my things. Let's go ahead and do that first, actually. Okay, so go ahead and close your eyes.
Okay.
I'm going to put one smell under your nose and tell me what you smell.
Orange.
Okay. I'm going to give your nose just a second. Okay, and then this one.
Peppermint.
Indeed. Yes, so that was orange essential oils and peppermint essential oils I used for the smelling test. So cranial nerve number 1 is intact for this patient. We're going to go ahead and take a peek in your nose now. Let me change cover. Okay. So I'm just going to hold on to your forehead and your nose while I look in. Okay, so nasal mucosa is pink, non-erythematous, no edema noted within the nose. Both airways are considered patent. I didn't notice any swelling closing off the turbinates or anything like that. Andy was able to smell. So all of that looks good. Next, we're going to take a peek at your mouth, and then we'll do a taste test as well. I know. Okay, so mouth is symmetrical, midline, lips are pink, slightly dry, but not too bad. I just realized earlier in my exam when I did the facial exam that I forgot to do TMJ, so I'm going to go ahead and do that now with the mouth exam. So what I'm going to do is hold on to your joint right here, have you open and close, and open and close. No crepitus noted on that. Was it painful or anything when you opened? No. Okay, so the TMJ joint is good. Okay, go ahead and open your mouth for me. Stick your tongue out for me. Okay. I'm going to have you do that again in a minute. Sorry, my light wasn't working. Okay, stick your tongue out again. Okay, say ah. Okay. Looks good. That's perfect. What's that blue? Oh, okay. No, you're good. You don't just say it all the time. Okay, I'm going to just stick this in here. Okay, your gag reflex is pretty good. I'm not going to go any farther than that. Okay, so for patient's tongue, his tongue is pink, midline. He's able to move it side to side. He's able to stick it out. No issues noted that direction. And let's see, we did the gag reflex. I was not able to elicit a gag reflex on this patient but he was able to do the all reflex, and his uvula did move. So that being said, I did test the cranial nerves for the tongue, which was cranial nerve 12, and the other cranial nerve that I tested was non-intact because I wasn't able to elicit a gag reflex. Otherwise, his mouth looks good. He has braces in his mouth, so I'm going to defer from doing the mouth inspection with gloves, but his teeth and everything are in good repair as well. Okay, so now I'm going to need my stethoscope. Okay, so now we're going to move on to your neck. Neck is symmetrical, no masses noted. I've already checked lymph nodes. Do you have any tenderness in your neck at all?
No.
Okay, so I am going to test range of motion, test your neck strength, listen and feel for your, carotid arteries and your thyroid. Okay? So let's do carotid arteries first. Go ahead and hold your breath for me. Okay, go ahead and breathe normal. Go ahead and hold your breath one more time. Breathe in. Carotid arteries are 2+ on each side. And then I'm going to hand you a bottle of water again. Hold on to that for just a second. I will have you take a drink and swallow here in a minute as I'm palpating your thyroid.
Do I need to scoot back?
Nope, you're good. Okay, so trachea, while I'm back here, feels midline. I'll look at it again from the front. And go ahead and take a drink.
I need to tip back or...
Yep. And swallow. Okay. Go ahead and do that one more time for me. Okay. Thyroid gland was palpated. Thyroid gland appears smooth. I didn't feel any nodules or bumps. Was that tender at all for you?
No.
Okay, so I do not picture any issues there. So we are going to listen. No. Yes, here in a second. I'm going to listen to your carotid arteries. But first I'm going to check your range of motion and your strength in your neck and your shoulders. So go ahead and look that direction for me and the other direction. Tip your head as far back as you can, as far forward as you can. Okay, good. And then shrug your shoulders. Okay, now we're going to do all those motions again, but I'm going to have push against you as you do it. So go ahead and turn. Okay, good. Turn this way. Okay, and then, oh yeah, sorry, head back. Okay, and then forward. Okay, and then shrug your shoulders. Okay, good. Range of motion and strength in the neck is intact. Range of motion, 5 out of 5. I'm going to go ahead and listen in here to our carotid arteries while we're up here. Listening for bruits, which I do not expect to find in a healthy patient without heart failure. Okay. No bruits noted. In the neck examination. Okay, we're going to move down to upper extremities. I feel like I'm forgetting something. Oh, testing of the range of motion and strength of the neck and shoulders is cranial nerve 11. So cranial nerve 11 is intact as well. Okay, and then, so next what I'm going to do is have you kind of put your arms out to the side. I'm going to palpate axillary lymph nodes. I'm sorry. I know it's ticklish. Okay, good?
Yes.
Okay, I'm going to need my reflex hand here in just a second. The skin on his upper extremities looks tan pink, consistent with the rest of his skin, all the way down to his fingernails. It is evident that patient bites fingernails. However, they are in fairly good condition.
Set me up.
Capillary refill is less than 3 seconds so far in all fingers. Yep, looks good. Let me see the palms. Have anything? Nope, no lesions or masses noted there. So I'm going to test reflexes in the front, in the back for the biceps and triceps, And then I am going to check range of motion and strengthen your arms. So I'm just going to kind of have you, dangle your arms the best you can. And I will hold on to them. Not you. So hard. His arm's bigger than my hand. He's saying he's never had this done, and that was weird. Sorry, I know it's hard for you to see. Okay? It's weird, huh? This setup is awkward, too. Typically, I'd have them sitting on the edge of the bed. It'd be a little easier.
I can sit up for him.
Nah, it's okay. No, I mean like where I'm standing.
Much better there.
Okay. All right, deep tendon reflexes are intact. 5 out of 5 for those. And then I need to check range of motion. So go ahead and put your hands straight out, and you flip them over, flip them back, right to the ceiling, and then all the way down. Okay? And then, so go ahead and do that with your hands. Push them all the way up. Just hands, sorry.
Oh,
Okay.
just hands.
Yeah. Okay.
What am I doing here?
Push down. Okay, now we're going to do your whole arm. So push your full arm down, but don't. Okay. Go ahead and flip them over again. Okay, push up. Okay. Upper arm strength and range of motion is intact. And put your shoulders out again, and then all the way up over your head, just in case. Okay, good. Okay, upper arms look good. I'm going to open this door back up, see if that helps. Sorry, I think the junior college still has their heater system going. I'm about 100 degrees.
That feels a lot better, actually.
Yeah, too hot. Okay, and then let's do your back and posterior chest next. So in order to do that, I'm going to go around to the other side. So I'm going to grab everything I need from over here. Okay. Oh, see, I've already
scoot back.
Yeah. No, you'll be okay. I need.
Oh, you're mark on me now.
Yep. Well, not yet. In a minute, that will. Okay, so I am gonna lift up your shirt just a little. And palpate. I don't feel any masses. Do you have any tenderness in your back?
No.
Okay, so no masses, no tenderness. The skin back here is consistent with other skin throughout. No excessive dryness, no lesions noted on his back. I am going to push up here a little more so you have some. Okay. So I'm going to take a listen to your lung sounds. Go ahead and take a deep breath in. Okay. And another again. Again, please. Okay, one more time. I liked 2 more times after that. And last time over here. Okay, so lung sounds are clear throughout. I'm gonna percuss his back, looking for any sign of dullness. Okay, so lungs are resonant throughout. I am now going to go ahead and do diaphragmatic excursion since I'm percussing right at the moment. Sorry, my hands are probably, well,
It's
no,
hot.
you're hot. I mean,
It's a
I'm
little
hot and ready to go.
A little ticklish.
Okay, so what I'm going to do is have you exhale out and hold your breath for a second. Okay. Now go ahead and take a big deep breath in and hold it. Okay, now you can breathe normal. This is washable marker, so you can wash it off. I am going to measure. We are at about 2 3/4, almost 3 centimeters for diaphragmatic excursion. I'm going to put my hands on your back and have you take a deep breath in and back, pull it back out. Okay, one more time. Okay, so he has one more time. Okay, and then I'm going to put my hands right here. I'm going to have you say 99.
99.
One more time.
99.
And one more time.
99.
Okay, so he has symmetric expansion of his lungs. His tactile fremitus is negative. I didn't feel any in his posterior chest.
Didn't again.
Okay, now I need to do, oh, we're dim again. I'm just gonna, I forgot to do Costco vertebral ankle test, so I am gonna go ahead and do that now. Tell me if you feel any tenderness. Any there?
Nope.
Any there?
Nope.
Okay, so that's negative. It's good. Okay, so now we're going to move to the front chest. Man, I have a heat stroke. Okay, we're going to move to the anterior chest. Yeah, you're going to have to do it in a minute. Oh my gosh, it just dawned on me again that I forgot to do the taste test even though I said I was going to do it. So I'm going to go back while we're still sitting up and do the taste test. I did bring salt and sugar from home. I wasn't 100% sure what to test sour with, so I just brought these two things to do testing with. I know, but you're not supposed to have to chew, according to the book. I should have thought of that, but I did not. Okay, so taste testing is important because it's cranial nerve number 7. Okay, so go ahead and close your eyes. And I'm going to give it to you, actually, I think. Because I have, yeah. So
what? Why like that?
Yep. Tell me what that is.
My eyes closed.
Yes.
Salt.
Okay, so
Table salt.
Table salt.
NaCl or something.
Okay, and then here's this one.
That would be sugar.
Okay, perfect.
Not sugar. But
The other thing that I have forgotten to do is on upper extremities is, you need a drink probably, huh?
sure.
Test sensation and positioning. So if you'll close your eyes for me, tell me whether you feel sharp or dull.
Dull.
And then how about soft or sharp over here?
Soft.
Okay, keep your eyes closed for me. Put your hands straight out in front of you.
Up or down?
The other way. Yep. Okay, I'm gonna move your fingers. Let me know if what position I'm moving your fingers in.
Up.
Okay. And this side.
Ooh, up and down. No, just down, I guess. I don't want your finger. Down.
Okay, down. Okay, so those are intact. You can put those down. Sorry, I forgot those. Okie dokie. Okay, so for the anterior chest, we are going to do a lot of the same things that we do for the posterior chest. No, you're good. Okay, so I'm going to go ahead and feel for masses again. I'm going to feel supraclavicular, infraclavicular, lymph nodes. Any pain?
No.
Tenderness in your chest area?
No.
Okay.
Just ticklish.
That's fine. Okay, so we're going to do percussion again. Those are resonant throughout. Take a deep breath. Okay. And last one. Okay, so lung fields on the anterior chest are clear to auscultation as well. When I have the patient lay down, I will check for heaves and thrills and all that good stuff. So, there we go. Think of what is next. Okay, so I'm going to go ahead and have you lay down, and I'm going to make sure the bed is at about a 45-degree angle, or 30 to 45, I guess. What? Oh. Okay, so I'm going to go over here. Have you turn your head to the side, just slightly over that way, sorry. Checking for jugular venous distension, indicator in right-sided heart failure. I do not see any of that, so I will not measure the angle, and there is no pulsation to measure. Otherwise, I'm not seeing any visible palpation points. I'm not seeing any, feeling any. So negative for heaves and thrills to the anterior chest. I'm gonna listen to heart tones. Okay, this is aortic area. Directly over is pulmonic area. Down from pulmonic is Erb's point. Tricuspid. And mitral areas. S1 and S2 are audible in all areas. I didn't hear any adventitious lung sounds. I'm sorry, adventitious heart sounds for him. And then let's go ahead and do abdomen next, I suppose. Okay, now we're going to assess abdomen. Sorry, I am going to pull your shirt up for this if that's okay. Okay, so for bowel sound, or for abdomen, everything looks symmetrical. Contour is round. I don't see any masses. I don't see any deformities. I'm going to go ahead and listen first before I palpate anything. That way the bowel sounds are accurate. I'm going to start in the right lower quadrant and work my way around clockwise. So bowel sounds are slightly hyperactive in all quadrants, but he ate right before we did this. So I am going to go ahead and lay the head down a little bit more so I can percuss the abdomen, palpate the abdomen, spleen, all that good stuff. Okay, so I'm going to lightly palpate the abdomen. Any tenderness?
No.
Okay, I'm going to do a little bit deeper now, okay?
Okay.
Any tenderness there?
No.
Okay. Okay, I'm going to percuss around for your liver. It's weird, huh? Okay. I am going to put a little fingernail mark right there. Sorry. So I'm able to hear dullness over the spleen and the liver. I'm going to grab my ruler really quick and measure how far out the liver is. To my fingernail mark is about 8.5 centimeters, which is normal in a male patient. I'm going to attempt to palpate the liver and the spleen and the kidneys, and we will see what we can find. Okay, it's going to be hard push, sorry. The edge of the liver is able to be palpated. Sorry, I know you're ticklish. No spleen. Unable to palpate the spleen.
Is that good?
Yes, that's good. And no laughing. Unable to palpate the kidneys, which is good as well. Okay, so while the patient is still laying down, we will go ahead and check. We're going to check arteries, and we're also going to check, would typically check for inguinal hernia, femoral pulses, things like that. So I'm going to listen to your abdominal arteries here. Well, aortic artery first, maybe, or aorta. Abdominal arteries. Listening for bruits. Again. Renal arteries. And then typically we would listen to the femoral arteries as well. I did not hear any bruits in any of those that I was able to test. Okay, so while the patient is still laying down, we're going to go ahead and do feet and legs, hips, etc. So I need to have you, sorry, my contact is falling out, or trying to. Okay, I need one of these. One of these. Okay, so skin tone on the legs is consistent with the rest of the skin. There are a couple scratches, superficial scratches on the ankles, and a small superficial abrasion distal to the knee,
Work-related.
that are apparently work-related. Otherwise, everything looks good. No pain or tenderness in your legs at all. Okay. We'll start with this leg. Can you raise that leg straight up to the ceiling for me? Okay, and put it back down. Let's go ahead and do the other one. Okay, then starting with the other leg again, bring your knee to your chest, please. And the other one. Okay. And you point your toes down and back up towards you. Wiggle your toes. Okay, so I'm going to put my hands kind of on your legs. No, okay, go ahead and push them up, but don't let me stop you. Push. I know. I know. Okay, good. Strength and range of motion in legs is good. Strength is 5 out of 5. Go ahead and close your eyes for me and tell me if you feel sharp or soft.
Sharp. Soft.
Okay, so sharp and soft, that is correct. Go ahead and keep your eyes closed. Tell me if your toe is going up or down.
Down.
And this toe?
Up.
Okay, I'm going to feel for dorsalis pedis pulses. They are 2+. 2+ pulses. Popliteal. Sorry, he's ticklish. Popliteal pulses are kind of hard to feel, but I do feel it on that side. I would say those are 1+ on those pulses. Okay. And then, so we've tested all that. What else do we need to do with your legs? I think laying down wise, that is it. Okay, so I'm going to go ahead and have you sit back up on the side of the bed.
Good.
And we're going to finish up your neurological exam, and I'm going to test your deep tendon reflexes in your knees.
Great.
So make sure they're kind of hanging a little. These are a little more difficult for me to get to.
I always have problems with these.
Patient has very slight deep tendon reflexes in his legs, so I will say those are weak, but he has stated that that is normal for him. Okay, so while we're working on things, do you remember those 3 words that I told you before?
Oh, man.
There was a color.
Blue.
Yep.
Car. 8.
Okay, so memory test is intact. As far as a simple memory test, you can also use mathematics and things like that to test memory. So I would say his deep tendon reflexes are all 4 out of 4, except for the patellar deep tendon reflex. I would say would be a 2 or a 3 out of 4. Able to get a response, but not a great one. Okay, so while you're sitting, I'm going to have you close your eyes. I'm going to have you put your hand out. Actually, both hands out. I'm sorry, palms up. Okay, so I'm going to put an item in each hand. I'm going to ask you to tell me which or what it is.
Paperclip.
Okay, there's a paper clip, and then that is
Coin, possibly a nickel.
coin is the other thing. So rapophagia is intact. And I know there's another test related to that, and I cannot remember it off the top of my head. Okay, moving on. Let's go ahead and have you work on some fine motor. I'll have you like this. Go like this, and go speed it up to as fast as you can. Okay, good. And finger to nose.
Oh, man.
As fast as you can. Okay, fine motor coordination is intact. And we have tested sensory with sharpened dull both on arms and legs previously. And we did well with that. So I am going to test his toe proprioception. I tested his toe proprioception already, but I am going to test that he can feel vibration with a tuning fork. I'm also going to have him run his heel down his tibia just to make sure his cerebellar function is intact, which he just did it, but I'm going to have him do it again. Can you do it one more time?
What that means.
One time on each side. Just run it all the way down. This means that a part of your brain is working correctly. Okay, and then I'm going to have you feel the vibration on your toe.
Yeah.
And how about this one?
I guess a little bit.
Yeah, I'll make it fit. I'll make it fair.
Oh, yeah.
Okay, so he can feel vibration from the tuning fork on both his feet, indicating that his sensory in his feet is good. Okay, so I'm going to go ahead and have him stand up. I'm going to do hip range of motion, a little bit of hip range of motion and spine range of motion, and then we will talk about breast exam, and then we'll be finished. Okay? Oh, sorry. Okay. Already threw me off.
Hips.
Okay, hip. Patient was able to walk into the exam room independently. His gait, what I'll have him do is walk out there. So I'm just going to have you walk normally to about a couple steps out of the door.
Okay.
Okay, and then turn around and walk heel toe back. There's a trick. Okay, so that looks good. Okay, and then I'm going to have you put your legs out to the side one at a time. Check hip range of motion, and then backwards and forward, like a kick. Okay, and the other one too, please.
Backwards?
Mm-hmm. And then forward on both. Okay, so I'd say hip strength and range of motion is intact. Hip strength is 4 out of 4. He's able to stand stable on his hips, etc. Hip-wise. Okay, so I'm going to have you put your arms straight out in front of you. We're going to do a Romberg test.
Ooh.
This is just step away from the bed, just a little. Okay, now close your eyes. I'm just checking your balance. See how you do with your eyes closed. Okay, Romberg intact. He's able to do heel to toe, walk normally. I'm going to have you go ahead and open your eyes and stand on one foot to balance. Okay, now go ahead and switch. Okay, so balance is good. We're going to go ahead and check the spine. So if you'll kind of bend, I don't know how to, yeah, like that, all the way. While he's doing that, I am going to run my hand up and down his back and make sure his spine is straight, no masses. That all looks good. Okay, you can stand straight back up. Now what you're going to do is at your hip level, bend backwards as far as you can. Okay, good. And then, bend side to side. And then twist. Side to side. Yeah. Okay, so back spine range of motion is intact. He's stable, able to stand on his feet. And then as far as a male breast exam, we did check the axillary and regional lymph nodes upon examination of the upper arms. But for a male breast exam, we would just palpate breast area, looking for any lumps, check nipples. We would check for discharge, check for abnormal hair growth, etc., just like we would on a female. So, for the full head to toe, the genitalia exam is deferred, and I think that is the conclusion of our exam. I'm going to go ahead and wash my hands for the final time, even though I've done it several times throughout the exam. Is there anything else we can do for you today?
No.
Okay, good. All right, everything looks good. I'll sign off on all your papers, and you'll be good to go.
Check.
All right. Thank you, Dorothy, for letting me do this from Hutchinson. I normally would not have water in the room with me, but they still have their heater on in here, and it seriously is probably 90 degrees. So I appreciate you letting me do this from Hutch. I did miss everybody today. I really, really hope that everything went well. And that being said, I'm going to go ahead and log off and pray that this all recorded. Have a good night. Thank you.